Good afternoon. My name is Isaac Wright, and I am the Chief Informatics Officer here at Grand Canyon University Hospital. Um, Today, I'm excited to talk about a new educational opportunity that we're rolling out with virtual patient simulations. This will help us implement some new evidence-based practice policies into our current guidelines. So first, let's talk about the importance of evidence-based practice. As you all know, this is huge. This is everything. This is all we do. It's going to reduce hospital length of stay. It's going to increase patient satisfaction. It's going to increase the confidence of our staff in implementing these new policy changes. It's going to reduce clinical errors, enhance care quality and consistency, and informs care decisions with current research. Um, we'll be supported by physicians and unit-based counsel champions. So here, let's talk about our learning objectives. Hopefully, we're going to be able to apply evidence-based practice in 3 of the virtual patient simulation scenarios within 30 days. The good thing about these scenarios is that they can be tailored and changed, and they are unit specific. So we have emergency department, trauma, oncology, intensive care. Um, all of these can be tailored to the specific unit needs for learning. We want them to demonstrate 90% accuracy on simulation based on assessments. They may have to retake them a couple times, but this will ensure that they're really cementing the evidence-based practice into memory. And then the most important thing is we want to identify and integrate at least 2 current guidelines into practice. So this is going to be by unit. Each unit, we want to have at least 2 new evidence-based practice policies to hopefully change and safely implement that our staff will be confident in. Let's look at the importance of the virtual patient simulation. What's the advantage? So they are immersive, hands-on learning. Staff's able to get real-time feedback and performance tracking. They're going to be able to have a diverse range of cases to look at. These tools they can be time sensitive, they can be critical patients, they respond to interventions. And the best part about it is that it's very low risk rather than trying new things in practice, which can be dangerous if not implemented well enough. So this is going to be our educational support framework. This is going to be the support that I'll be offering to our clinical educators are going to be spearheading this new rollout. I'll get IT on board. IT will be available for anything that we need, connectivity, credentialing, and ensuring that all of our staff has access to these platforms. We're also going to have evidence-based practice mentors. These are going to be on each unit. We're going to assign 1 or 2 nurses to this role, and they're going to be the ones who are going to be kind of giving us feedback on what policies we want to implement. External, we're going to have Body Interact subscription. That'll be I already talked to the hospital. They went ahead and greenlighted our funding on this. And then we'll, of course, have our evidence-based practice databases and clinical decision platforms such as PubMed, and we have Lippincott to kind of look for policies to implement. Here we're looking at our educational time frame. It's going to be about a 6-week rollout. Week 1, we're going to have staff orientation and tool access. We'll have IT on site. For each class, we're going to do 2 classes a day, 4 days a week, Monday through Thursday. We're going to have an evening class as well for night shift to hopefully be able to get off in time. Weeks 2 through 4, we're going to have staff doing the modules and working on these patients. Week 5, we're going to be looking at the simulation assessments and the feedback, see how well they do. Again, we're aiming for 90% accuracy. And week 6, we're going to do the post-assessment survey and plan revision. This is where we're all going to get together. We'll have our evidence-based practice champions looking at which policies we want to implement onto each unit. For engagement, we're going to be using digital and physical platforms. We'll of course be posting at each unit's bulletin board. We'll have flyers around the hospital. We'll be sending out emails. We'll have our evidence-based practice champions informing staff in each of their unit meetings that this is going to be rolling out, kind of preparing them for it. We'll have them informed and able to prepare staff for these rollouts. We'll also have some recorded sessions and 24-hour IT available for anyone who can't make it, especially night shifters. Can't forget about them. They still need to get access. And how are we going to measure our success? So pre and post test on the evidence-based practice knowledge. This will pull from our Lippincott, and it'll give us an idea of how staff have learned about this new evidence-based practice changes. Additionally, we'll be looking at the simulation performance metrics, aiming for 90% there, and we're going to have participant surveys, self-reflection. These are going to be, how does the staff feel about these? What do they feel like? What kind of value has this brought their practice? And do we want to maybe look at doing this again in 6 months or a year, depending on how our new evidence-based practice policies are positively impacting our patients and our units. Thank you for listening to this presentation for our educators, and I'm excited about rolling this out. Any questions, you guys can email me, reach out through text. My number will be at the end of this presentation.